Perinatal morbidity and mortality is one of the areas that slower improvement has been seen over the years. In some cases, it has remained the same. Nearly half of under 5 deaths take place in the neonatal period. To ensure every child survives and thrives to reach their full potential, we must focus on improving care around the time of birth and the first week of life.
Hi, I'm in the Barbados NICU in Queen Elizabeth Hospital, and I'm a preemie mommy. This means I've had a baby that's born before 37 weeks. My baby came around 27 weeks, and she is just under 1,600 grams. When she came, she was a bit smaller than that. It is a different experience. It's, of course, a very unusual and unexpected experience, but the support here with the staff is something that helps get you through the whole process when they educate you on what's going on, how the baby is developing, the different type of treatments, or any things that you can do to help the baby progress and come home faster. Things like kangaroo care is encouraged here, talking to the baby, spending time with the baby, and expressing my faith and belief to my child. That is the most paramount thing, and that's encouraged.
This was the first ever regional conference on advanced neonatal care in the Eastern Caribbean. This milestone event brought together clinicians, administrators, leading perinatal health specialists from North America, South America, Europe, and key intergovernmental health agencies from the region.
World Pediatric Project has been providing advanced medical care to children and training to health workers in Central America and the Caribbean since 2001. We've worked hard to develop long-term partnerships with ministries of health and regional organizations in order to deepen the sustainability and impact of our work. Partnering with the WHO and PAHO on this unique and groundbreaking neonatal conference was an opportunity for us to help bring together frontline clinicians, government officials, NGOs, and the academic community to discuss how to truly and effectively regionalize neonatal care in this part of the world. World Pediatric Project and PAHO have been allies in the region for many years, but this project marked our first true collaboration together, one which we hope will continue in the years to come as we work towards our shared goals of improving perinatal health in the Eastern Caribbean.
I'm John. I'm the president of the Rotary Club of Barbados West. Rotary, PAHO are names of organizations associated with the word excellence. In February 2019, the Rotary Club of Barbados West and the Rotary Club of West Richmond, in partnership with World Pediatric Project and the Pan American Health Organization, hosted the very first conference on improving perinatal care in Barbados and the Eastern Caribbean. Together, we work towards the shared goal of enhancing neonatal care in our region. The conference was very well attended and extremely informative. Rotary's experience working with PAHO can definitely be described as very satisfying and a very satisfying and productive collaboration. And our organization looks forward to working with PAHO in the near future on similar type projects.
In the Eastern Caribbean, we've been looking after babies for a long time. But as babies become smaller and more premature, and we have greater expectations as what can be done for them throughout the world, we too have been working to improve the survival, both in quality and in numbers, of our smallest and sickest babies. For the first time in the Eastern Caribbean, we brought together a group of people who provide frontline care for babies at a conference held in Barbados in February of 2019. This was sponsored by the World Pediatric Project, the Pan American Health Organization, and Rotary International. And it was the first time that really face-to-face we could discuss our common problems and our plans for the future. While work is done at a technical level and a human resource level, this network building and sharing of our resources is an area for development that was facilitated at this conference. The NICUs in various islands are at various stages of development and obviously have different needs. At the conference, we had academic sessions detailing the most recent advances in the diseases that we all treat. But more importantly, we were able to identify strengths and challenges for the various units and find ways to cooperate. Coming out of this were some specific exciting developments related to a pooled procurement of obtaining drug resources, and also a way to share the expertise that we have, particularly through the auspices of the World Pediatric Project, coordinating the delivery of specialized care to babies born with congenital heart disease. Overall, it is expected that we can help each other to develop the services we offer for newborn babies.
I'm Dr. Duncan Adams, pediatric neurologist at the Milton Cato Memorial Hospital. I would have had attended the conference in Barbados hosted by the World Pediatric Project on the 7th and 8th of February. And after attending this conference, would have taken the information that we would have gotten at the conference back to St. Vincent and the Grenadines, to our NICU. The conference was one that I considered to be excellent, especially in the areas of nutrition, in the management of cardiopathic patients, and in other areas that were discussed. Changes that we would have implemented since this conference would have been, particularly for patients who are hypothermic, we would have had a discussion among the team and have decided to implement this protocol as part of our protocol manual for the management of children with hypoxic ischemic encephalopathy. So that we have already done. Another area that we would have had implemented much more, or should I say adhered to much more diligently, would be that of nutrition. We are adhering more to the feeding protocols that were established and are trying to not limit or take away feedings from babies unless it is absolutely necessary. We are still advocating for the use of the TPN. However, we have not been able to get that as yet, knowing that the decision for this would take a little longer coming from a higher level. But all in all, we have given feedback to the rest of the staff, and a lot of what was said has been accepted, and there's been lots of discussion on how we can move forward, a lot of it being from a ministerial level. But so all in all, things have been going pretty well.
I'm Dr. Robert Fleming. I'm a neonatologist in St. Louis, and I've been working with the World Pediatric Project over several years on an initiative to improve newborn outcomes in the Caribbean, East Caribbean region. And over the course of that time, it's been my privilege to get down to different islands with a group of other doctors, nurses, respiratory therapists, nurse practitioners, all involved in working directly with the people in each of the local settings in educational projects, in providing supplies, equipment, how to use the equipment, and some systems changes as well to improve the care that's being provided for the babies in each one of those settings. It became clear over time that the biggest issues had nothing to do with the personnel that were there. They were all very dedicated, very caring, and really were just wonderful to work with. It was more a matter of bringing into each one of the settings the kinds of additional information that just wouldn't otherwise have come about, simply because of the relative remoteness of one island from another, and the fact that the overall size of the population in each one of the islands isn't great enough to otherwise provide that level of equipment and expertise. It also became clear that the issues were similar across each of the islands, and that perhaps the best way to approach this was to bring people together. So for that reason, we talked to the World Pediatric Project, who then worked with PAHO and the East Caribbean Health Alliance to put together a conference where the people on the ground, the people actually taking care of the babies, could be all brought together and talk about the ways they could most improve their efficacy in their settings. Not only that, it brought together the administrators who could help bring the process about and bring the funds together and bring in the other kinds of structural situations that need to be put in place to bring this all about. Over the course of those several days, it was a wonderful conference. The commonality was very apparent from the beginning, that the same issues that were most problematic and the greatest challenge in one setting were also the same as in another. And it was, I think, very useful just to be able to hear that. And it was also useful to be able to have each setting provide what they thought was ways that they could best deal with them. And in the course of that, we identified certain areas where we thought we could take things from here, maybe focus in on several particular aspects of newborn care that we could work together best on, that would make the biggest difference, and that would have the ability to have some long-term sustainability that would really make a difference for the babies. And I think this is probably the single best way that we can take care of our most vulnerable and most valuable resource, and that's the children of our future.
So the impact of the perinatal conference, I think, was a big one. It was important in this specialized area of perinatal care, and in our small countries and populations, for us to look together at what resources we have, human and otherwise, and to be able to share experiences, understand that limitations are not unique to one country, and to be able to work together to move forward. I think World Pediatric Project, PAHO, and the Rotary Club really achieved their vision with this conference. With regards to the OECS, I think it works synergistically with our own plans to start at the Eastern Caribbean Maternal and Neonatal Alliance. And again, it's all about working better together. There are many players that maybe feel isolated in the different islands. And if we get together, we can really move forward to ensure that the very youngest of our population have the very best chance when they start their life.
From club perspective, the meeting Improving Perinatal Care in Barbados and Eastern Caribbean has been an extremely relevant milestone. The importance of that meeting is due to the focus placed on the implementation of policies and interventions aimed at improving the quality of care and health outcomes of newborns and their families, working with different stakeholders, to the wide and active participation of colleagues from the countries, and to the coordinated work among partners such as the World Pediatric Project, Rotary International, in coordination with PAHO, WHO, the Newborn Health Alliance for Latin America and the Caribbean, and the support of USAID. From what was presented and analyzed during the sessions, we are sure that technical cooperation will be strengthened. The main lines of action will include continuing strengthening quality of care, promoting analysis and audit of fetal and neonatal deaths, preventing blindness as a result of retinopathy of prematurity and other conditions associated with prematurity, and strengthening information systems, particularly the perinatal information system, SIP, that will contribute to improve quality of care and to monitor and evaluate the care provided and the results. So these lines of work will finally contribute to the achievement of the SDGs and the objectives established by the Plan of Action for Women's, Children and Adolescent Health, which established reducing preventable deaths, promoting health and well-being, and promoting healthy environments along the life course.
PAHO WHO embraces this partnership and will continue this coordination in the future, with the shared goal of working towards a cooperative and innovative approach to enhancing neonatal care in the Caribbean.